Hi, I'm Mary Tantillo. I am an associate professor of clinical nursing at the University of Rochester School of Nursing, and also I'm the director of the Western New York Comprehensive Care Center for Eating Disorders. We definitely are probably missing a lot of folks who develop eating disorders later in life. It's already a challenge for pediatricians and family medicine docs to catch it early on. But when women age, for example, the New York Times article said that osteoporosis, bone loss, for example, could be overlooked because people kind of think in normative ways. Like they think, well, you know, the person's going into menopause, so it's probably that. In our society, in our broader Western culture, being thin and looking gaunt, unfortunately, has come to be a normative thing. It doesn't mean it's normal, but unfortunately, you know, I've talked with people who've gone to their internist office, their OBGYN offices, not all, but a number, and they're often told to lose weight even when they might be at a healthy weight. Also in our culture, it's again normative for women to be very body conscious. The media the weight loss industry does a great job, I'm saying this facetiously, of making us feel anxious about our bodies, to find something wrong with us. And so as women age, our culture is not very kind. We have a very small window, which is called 0 to size 2. And women are supposed to fit themselves into this. And you know, as you get older, your belly gets a little bit more protruding. That's normal. You gain a little bit of weight. When you have children, that's normal. But in our culture, women come to feel that that's not right. And then unfortunately, some physicians may also get caught up in the culture and just be prescribing weight loss, even for people who might need to be at a heavier than average weight, let's just say, because their family history is such. Even what's average starts to look like it's overweight in the eyes of the media and in the eyes of our culture, because we stigmatize obesity, and we've kind of all gone the other way, so that when a woman who is older, you know, starts losing weight, people will praise her and think that's a good thing, instead of trying to understand her weight history across her lifetime. And because that's the only way we know where people should be, not just, you know, looking thin. Transitional points can be very stressful for people who are already wired in a way that they're kind of anxious in the world. People with eating disorders also tend to think in all or nothing ways, or they tend to think in ways that are more overgeneralized, like when one thing happens, they're afraid it'll keep happening. And when you have these kinds of reasoning patterns or ways of thinking, and it's hard to look at the gray in life, and you tend to think in black and white, then when these developmental transitions happen, they're even more stressful for that person. If you're a loved one who's worried about somebody, the worst thing you can do is stay quiet. If you need to meet with other loved ones to kind of think about what to do about the person, then do it. Don't ever be alone with this illness. Or seek out a mental health therapist and get a consult about what you might do. Or go to a trusted primary care physician if you don't have a mental health therapist in your life. Start with a professional or the people you love to make a plan about approaching this other person. Don't be silent, because silence kills people. Eating disorders kill because of silence and disconnection and isolation. Go to the person. You might want to go on the National Eating Disorder Association website and look at the part that tells you kind of what to say. But basically, here's the message to the person. First of all, you in your head need to remember they're not the illness. You're talking to the person. And the eating disorder should be talked about as if it's an external thing that's taking advantage of the person, that's hurting them, that's keeping them from having a full quality of life that they deserve. And you just say to them, you know, I love you, I'm worried about you, here's why. Be warm, be factual, do not be blaming or shaming, share exactly what you've seen. For example, I love you and I'm worried because I've noticed that every time we sit down to a meal, right when we stop, you go immediately to the bathroom. Or I've heard you throw up in the bathroom. Or I've seen empty laxative boxes around, you know. Or I've noticed that you've dropped a lot of weight in the last few months, and I'm just really scared for you. And after you're done saying in a warm and loving way, in a factual way, what you've observed, you know, you can even say, I'm not sure if you agree with me or not, and if you don't, it's okay. But as someone who loves you, I felt I couldn't hold this back anymore. And you might even want to say, if there is something wrong, I really am willing to help you in any way that would help. I mean, go to a doctor, whatever it would take, I just want to let you know I love you and I want to be available to you. That's what I would do.